Hi, everyone. ANneMarie here with an AMC Connects, and looking forward to an episode where we just kind of touch base on some basic policies and procedures and why that's important, because I've had a few questions come up through the organization. So glad to be able to do that and maybe explain a deep dive. I do want you to always tell me what you think. These are topics that I've heard about over the last week from our employees, and some a bit from feedback from the community. So I'm excited to be able to do that. Of course, I have a guest on a very important topic that we've touched on a few times, so stay with me, everyone. Welcome back, everyone. As I shared in the introduction, really important to go over the reason we have policies, the reasons we have procedures, and on a very basic level, we're required to. We know as a non-for-profit healthcare institution that we're really accountable to New York State and to CMS to be able to have policies and procedures that line up with conditions of participation that authorize us to be able to administer healthcare. And so here at Rome Health, we do a great job adhering to the expectations in healthcare and meeting those. Always proud to be able to partner with agencies that make sure that we're doing everything that we're called to do, told to do, in a way that makes sense with our mission, vision, and values. And I would say, lining up with our mission, vision, and values, we do have policies that are really designed to make sure that we live out our mission, vision, and values in a way that's consistent to the community. So on a very basic level, that's why we have policies and procedures and guidelines. Those are other terms that we use to be able to guide how it is that we engage and work, depending on our role for the organization. So I really want to underscore that because we have had over the years questions on why we do things, how we do things. And if you haven't visited your policies and procedures in a bit of time because you have experience and great supervisors that help guide that, I always encourage you to do that. I was really happy on rounds recently. I was in our AM Surge department connecting with that team, amazing group of people. And it was great because one of our nurses said, well, I'm going to pull out the policy, and right here, ANneMarie, can we go over a couple aspects to it? I was like, absolutely we can. And I thought that was wonderful because we were really referencing the policy in the context of change and new things that could happen, which is another great use of the policy manual. Well, one such policy that I do want to underscore and go over is actually the service recovery policy. And the service recovery policy we use in a couple different frames. It's ADM 062 if you're looking for that reference in our particular manual. But one area that I wanted to underscore for us is our AIDET communication. We do see on our evaluations on an annual basis how are all of us doing with the AIDET model of communication. We do know that scripting in healthcare can be very helpful and useful to adapt to make sure that all of us are conveying a sense of togetherness and how we engage with people in the community. Recently, I did have a community member write into me to share that they were really disappointed on how one part of the workforce was talking with them and their family member. And so I got the idea, it's let's just revisit one of the ways to make sure that we work together and communicate together. So we're going to go over what AIDET stands for. It's a well-published model to communicate, but AIDET stands for acknowledge, introduce, duration, explain, and thanks. And what the acknowledgement is immediately acknowledge the importance of every patient and family member in confirming their presence in the care. Introducing ourselves, really important to introduce ourselves by our name and the title with which we serve in the organization. I do that a lot on patient rounds and when I'm working with all of you. Duration, it's really important to set clear expectations with patients and family members and providing information, particularly on timing. I believe Allison Danello was here with us quite a few episodes ago, and she underscored that the notion of communication, particularly follow-up, our community is hungry for, as they should. People want to understand better and better, especially in a stressful moment like seeking care, of what the time frame would be that they could accept or know that we're going to follow up with them. Explain. We want to make sure that we explain to the patient and family members about what they can expect and be as clear and concise as possible. people. That's something I've personally worked on a lot, and I've gotten feedback from people. When I want to verify if I'm clear or if people understand me, I just ask them, can you share with me what you heard in this conversation? Or did I answer all your questions? And that's always very helpful. And always we want to take the time here at Rome Health to thank. Take that time to thank everyone for either asking questions, bringing concerns forward. And again, I'll kind of quote another previous guest on the episode, Ashley Edwards. When I said to Ashley, gee, Ashley, what do you think we can do and do better here at Rome Health? Or what do we always keep in mind in the midst of change and stress? And Chuck, do you remember this, what she said? It was so basic. Do you remember?
You are so good at all this. I'm great. As you're talking, I'm sitting there thinking in my head, I'm like, where was this in the conversation? Because I'm worried about editing it and I want to get it there quick. So it's like, I got to figure out where she said that. But yes, I do.
And Ashley said, be kind. And so
always be kind.
Always be kind. And AIDET is a way that we can convey that kindness through the course of scripting. So please make sure, all of us as Rome Health employees, that we're conversing with our patients and their caregivers or loved ones in the AIDET format. And again, it is on our evaluation, so we'll continue to make sure all of us feel comfortable and we're monitoring and measuring that we're actually communicating in that fashion. Another policy that I've been a part of a couple conversations with recently is our professional dress policy. And professional dress and appearance, that's a policy that's HR 011. And it's a policy that references nicely how it is that we want to reflect ourselves as a workforce to each other and to the community. We do really recognize that there's been a couple changes over the years as our community has grown and changed. We've grown and changed. How do we want to make sure that we reflect things? And so just kind of the top of the policy is it's a policy that Rome Health, that employees' appearance be appropriate to the work situation and environment. Every employee, provider, and student has some contact with the public, representing the organization in their appearance, and should create a favorable image reflective of our basic core values, or I would say mission. And so things that we've talked about in the past, like making sure we have our badge on, that it's up on our upper torso, so that we can have the community know and identify us readily. So the policy does go over those types of things. Our policy does give us a great deal of detail in terms of guidance. Those of us who touch patients, or those of us who support those who do touch patients, that we're in an appropriate attire, and the policy goes over that. Whether we're in clinical services and our scrub attire, or we're in support services, a shout out to our EVS tech departments and our security departments. They have very formal uniform wear. And when I'm kind of auditing how our policies and procedures are doing, those are departments that are really always reflecting exactly what the policy outlines for them. So thank you. But the expectation is all of us do that as well. And some people have asked me, well, like, where does this come from and why? And I said it at the top of the episode. We want to make sure what we do each and every day is reflecting our mission, vision, and values. It has been well published in healthcare, as well as some other industries, that communities can connect with us better when we have a consistent image that we're reflecting. It's not in any way to take away our individuality. It's really to represent our industry, which is healthcare, and our core values in an institution. So I thought I'd pull and summarize some of the literature like I do sometimes, but in reviewing the evidence, there's 5 major themes that were consistently identified in the literature and formed the basis of, kind of final recommendations, and our policy is really consistent with this. Identification. The community wants to be able to identify us and our roles with which we're encountering them. Professionalism, the community does, and people groups really do expect healthcare to reflect themselves in a professional manner. Thus, sometimes when we designate or have more formal uniform attire, it really helps convey that professionalism. Functionality and practicality. When I was doing the majority of my work as a primary nurse, I really needed to have pockets. And so people appreciate that. We need to have pockets because I was always holding something, and scissors and pill crushers and stethoscopes and all of that. And the community really appreciates that we have functional attire if that's pertinent for your role. Hair hygiene. Patients do prefer to be able to see caregivers, particularly at the bedside or those interacting with patients in clinical care, that it's pulled up and tight, and our policy does reflect that if you have long hair, such as mine, I guess. Also, based on informal and verbal feedback from patients and other healthcare providers within our organization, we found a positive correlation between standardized attire and identification of staff. Patients and family members find the color coding of staff helpful at times in easily being able to identify the care provider. That's kind of consistent here at Rome Health. That was a quote from the literature, by the way, a few articles, and that our maternity department had really set a standard for safety and a number of other reasons that were important to the community that they wear purple. They're actually the only clinical program and department that is permitted to wear purple for those safety reasons. That's how they interpreted the literature and what they're called to do in terms of that specialty. So another great example. And then last, I'll just kind of summarize the literature on maintaining a professional image. Identification of healthcare team members is challenging because multiple healthcare team members often wear scrubs and scrub attire. This can cause confusion not only for patients and their families, but for healthcare team members too. Patients, families, and other healthcare team members need to be able to identify who is providing care to the patient. Again, that's a summary point from the literature, and our community is reflecting some of the same recommendations for us. People want to identify people very quickly, especially in times of busyness and stress, and boy do we know it. Here at Rome Health, on rounds just this morning, I had heard from a variety of different people how busy the organization has been since we turned the page into 2026. And so we have a number of urgent events where lots of people show up. So using our words and our scripting of who we are and how we're here to be able to take care of a patient, as well as our attire. So I hope that clears up some questions that I had heard from discussions at different small group meetings, as well as on rounds. Well, another policy, which is a very hot topic. It wasn't just the policy that gave me the reason for our guest today. We'll get to that in just a second, but a reminder on parking. We're going to talk about parking throughout 2026 because, as I shared, our Chief Operating Officer and our Director of Building Services and Plan Ops are very committed to making sure that we track and trend our parking situation at Rome because we're busy and we want to make sure that our employees are safe and that our patients that we're taking care of and family members have what they need to get care from us in a timely manner. So we do have a parking policy. I would ask that people visit and revisit it. I'm just going to talk briefly about the highlights that Rome Health and the City of Rome Ordinance number 3357, and in our policy manual, it is admin-047 to control parking and traffic at the hospital is a major priority. This policy is designed to improve traffic control and provide the necessary access for fire and emergency vehicles. Employees and physicians must adhere to the following parking regulations. We do have staff parking that is provided in blue and signs are designated, provider parking, which is provided in red, patient and visitor parking, which is provided and designated in orange. I do have to say further on in the policy that it outlines that employees are not under any circumstances to park in the following restricted areas. Patient and all visitor parking, that's labeled orange, and handicap parking. I think Chuck has a map he'll probably throw up there as I'm talking. I think he put that together with our director, which we're going to introduce, unless permitted to do so. Okay, a long area yellow painted curbs, outside of striped lines which identify the end of the parking lane, and hospital use vehicles only parking area. The man that helps us strategize and envision how we can make sure that we have safe and accessible parking is Allen Hurd. We are so grateful to have him on the episode today. Allen, welcome to AMC Connects.
Thank you. Thanks for having me.
Wow. Like, not just related to this parking policy and other things that we're challenged with. We're going to try to get into all the above because you're kind of like the man of the hour when we think about all these things that we've talked about, right, Chuck, on AMC Connects.
Absolutely.
We've celebrated 2025 and all that happened, and we talked a little bit about what's going to be happening in 2026, and you are like the leader pushing through and leading the way for all of this wonderful work that's happening. I'll start with thank you.
Well, thank you. I appreciate the acknowledgement.
Yeah.
You're definitely a busy group down in Plan Ops and Environmental Services and Security, doing everything we can to move forward with the projects that we have lined up for us.
Yeah, you started to jump in, but underscore for us your title for the organization, and you just kind of gave us a sneak peek, but what your role oversees for the organization.
So I'm director of plant operations. I also have security, safety, and environmental services. My team of leadership underneath me, we able to maintain and do any project that we have, or help out with any project that comes up from the organization, and making sure that we're safe and secure and have the opportunity to provide the services that we need for the organization.
Yeah. And I mean, I'm just going to kind of ask an open-ended question. Like, how do you think we're doing? We've got like this huge strategic plan that we've undergone, and you came in like, wow, in the middle of it, which is probably one of the, I would say, doing a lot of project planning in my lifetime, one of the hardest times to come in and lead through a pretty big, bold plan. And then we've had like daily life that's just a lot. How do you think we're doing?
I think we're doing well. We've had a lot of projects in the last, Ryan boasting this, 4 years, where we really haven't stopped from moving forward with the projects, and it's great. We're talking about moving forward with more projects, and then our day-to-day stuff, as you said. We just completed virtual nursing. We just completed another office move, Neuropalm. So I think we're doing great. The team has been working well. I can't say enough good about them. When I give them a suggestion or, hey, can you help me? They're all over it, and they just make sure that we give that service to the organization that we can.
Yeah. I mean, along with their technical skill, Alan, it seems like that when I interact with them, just the brief times I get to, but they're always like looking out for all of us. I think it was maybe a couple weeks ago, the elevator going into like the main med center administration from behind. When you go through that back, I think the elevator had to be fixed, and I was just kind of standing there waiting for them to be done, and they were so conscious of people coming in and out and talking with them. Like, for people who have technical skills, you know, I, at one point in my life, I prided myself on being a good technician, but then to also be able to have the awareness of what's going on around them, like that seems like a top-notch team. Am I reading into that right? I was just really kind of blown away by how they were interacting with people while they were trying to fix, you know, any given technical component of the institution that we've got, right?
Yeah, they have a lot of care and compassion for everybody in the organization, either be a patient, a staff member, family member, because they know that at any point in time, that could be one of their family members that's here being treated. So they always want to make sure that we lead from the front. We show that we're here to give the services to everybody. And that's what we are. We're a service department. All of our departments are service departments to support the patients and the patient care that we give here. And they do. They take their compassion and their caring to the next level, I think, over their technical skills.
Yeah. Wow. Is that something that is organically in them as part of the workforce, or is that also something that you work with them on? Again, technicians, right? That they have this really important skill and resource for the organization, and sometimes we can get laser focused on that, but seeing the big picture, how do you lead and serve them to make sure that they have both?
So I lead from the front. I go out and I show them what we expect when we go into a room or we interact with a patient or a staff member. There can be challenges, definitely, when we're out there dealing with the staff and the public and the patients and whoever that we're dealing with on a day-to-day basis. But knowing that, just as you mentioned earlier, we have to announce who we are. We have to talk about what we're doing. We have to thank them for coming in. When I go into a room to look at a problem that might be there, the first thing I do is announce who we are. We talk about, hey, we're maintenance or we're environmental services. We're here to take a look at your room. We heard there's a problem. Thank you for letting us come in. And leading that is really blossoms the rest of the team to be able to do the same thing. They come in, they announce who they are, they let you know what they're doing in the room. Can we do this in the room? Is there a better time I can come back? Maybe you don't feel up to having some company in the room at the time. So it's really just trying to show that care and compassion. And it kind of grows on them, but this group has a unique background where they have that technical skill, but I think that we're all here because we have that level of care and compassion. You have to.
Yeah, in healthcare, right?
Yeah.
Kudos to them. That's great. And I like to think, you know, even making sure that our support services, when they're interacting with patients, that's great. Maybe just linking back to the other policy with professional dress, do I read that right, that your departments really do a nice job of kind of embracing the professional dress with which they represent? And do they like that, or what's their feedback?
Yeah, they all take pride in it, and if there's a special event coming up, they'll come talk to me. Like they go Red for Women in EVS. recently. They said, hey, can we wear red shirts today instead of our maroons? Absolutely, go support the cause. But they do. They take it as it's a sign of professionalism for them. Plant ops is in their grays, security always in their black uniforms with their logo on it. Same thing with environmental services. They take pride in that professionalism and bringing it to the organization.
Yeah, that's great, Alan. I sense that on rounds and when I get the opportunity to connect with them or they're fixing something for me and whatnot. That's great. Okay, we got to talk about the parking topic. We've got to talk about it. What I'm sensing, like over the last couple of weeks or so, that our adherence to the parking policy, thus it rose to the level of an AMC Connects. We're not quite connecting with this policy in terms of compliance with it. Am I reading that right? And what do you think about it? And is there more parking to it? Ellen, are you going to fix the parking picture for us all?
Parking's a challenge, especially when we hit the winter months. You know, we start losing the sight of the lines.
Yeah.
We have snowbanks out there that we're trying to pass or plow around and get people around. And we get caught with a rogue snowstorm at 2 a.m. It's hard to get them cleaned out in time for our staff and patients
Although
to come in.
they've done excellent this year.
They have done an amazing job with everything we've asked them to do. Even in it's a little bit shorthanded with our guys, but they're doing a great job and really maintaining what we have. So it is a challenge, and especially hit the wintertime months, it's a challenge even worse. This spring, we're looking to do some maintenance around the facility, working on striping, working on some ceilings, some painting, some really just designating areas that need to do. They take a beating over the wintertime with the salt. The salt, I mean, we just had the medical center paved a couple of years ago, and it's starting to show its age already. So the salt is a killer for us, but we're going to do some repairs and some maintenance this spring and summer, get them some lines on there and help out. You know, we can ask that, you know, as we're pulling in the staff, if you don't see a line, try to be a little courteous of your neighbor and pull a little bit closer. I don't want you to obviously door ding them, but help out as we can get a little bit closer and not leave such big gaps in between cars. It's definitely going to help us out, get more people in where we need to. Yeah. And definitely stay out of the visitor and restricted lots and park in the patient lot or the staff lots. Yeah. Properly so that we can maintain for the patients that need to get into the facility. You know, we did a great job, I think, coming into the winter months. We kind of got a little bit away from it in the winter here. I think as a team, if we have that approach and we re-educate our staff again where they need to go and help our security help get them out there to where they need to be, it's going to help us out with the parking in the long run. We've got some other initiatives we've been thinking about. I'm not sure where we're going to go with them yet, some potential valet parking or assigned parking just to help us get some freed up spots. So definitely some things we've been working on in the background to see what we can do to help out the organization. Definitely challenges with all of them, sure. But you know, what we can do to help us out is definitely park where you're supposed to park and think of the visitors and think of the patients that are coming in first when you're parking. Park away from the building if you possibly can. Yep. Leave those open spots in the big lots for our patients that are coming in the ED or coming into the main entrance.
Yes. Thank you, Alan. Alan jumped ahead perfectly. He gave us a glimmer of what's to come. Thank you for that. And what we need to be doing as employees and be mindful of. And I really appreciate the clarity, Alan, that you just said, like, let's think of our patients first in the day and the loved ones that they might need to be bringing. So if we can, even park farther away. I've been really trying to be mindful of that myself because we do have really good access to parking a little while away. You know, I mean, we're used to a lot of convenience here on this main campus for sure. But, you know, I came from an organization that, wow, I mean, it was like a half a mile. If you were walking, if you were doing surface lots or something. I mean, maybe not quite that far. You'd be like, ANneMarie, I could measure that. And I don't think it was a half a mile. It felt that way.
It's a little stretch.
We believe you. We believe you.
It was a stretch. Nobody.
It was all uphill too.
Get your steps in.
Those people in circuit. Right. I mean, there's something to be said with that too. I did remind myself of that. You know, all week as I was parking a little bit farther out. It's healthy for us to get some steps into, and it's really not that far. You do create a lot of nice parking that's maybe off the, you know, the zones that's too close to the hospital. So thank you for those reminders. And we got this, everyone. We did really well, as Alan said, going into the winter months. And we need to stay on track and adhere to the policy and certainly give Alan feedback. But, you know, wow, Alan, I did say this on another episode, but the heated sidewalks, like, wouldn't have been great if the entire campus was heated.
I wish. I only wish.
Right. If only money was not a thing.
Well, yeah, if we had the opportunity to do it, we definitely would. The heated sidewalks are a lifesaver for our guys and for our patients and staff.
Gosh, a win-win-win, right? Good for
Absolutely.
you. Thank you for that. I've been really wanting to get into a question that I've wanted to ask you. I don't know why I just haven't stopped by and asked you before now or when we've had the chance to see it, but we're always so busy. It feels like you're always so busy. You're a busy guy, keeping us moving.
Keep it moving.
Yeah. But one of the questions I wanted to ask you was, what has been your favorite all-time, Chuck, this wasn't on the list, right?
I was getting nervous. I thought you were going into, I was like ready to hit buttons here. So go ahead. I'm sorry.
No, we're having fun. So, Alan, what's been your favorite project? What was your favorite moment in time since you've been with Rome Health?
It's definitely been the surgical center. There's not an opportunity for these big projects that come in your career like this very often. This has been a great build from the ground up. And I came in at the design phase of it. We've been able to make it come to life. I know Jim Marquette's been helping us out. He's been a big component of this right from the get-go. And you really don't, as a facilities director, get the opportunity to put these bigger projects in the ground from ground up to go. And to be able to do it and open the way we did without delay or delaying any patient care was amazing.
Yeah.
The teams really worked together to make sure that we kicked these, both ICU and the OR, off without a glitch. It's been a great opportunity.
Yeah, congratulations.
Thank you.
It is spectacular. And we have another phase coming up online, right? You don't get to rest.
Absolutely not. Next phase up, just here in probably early April, we'll be opening up our new PACU bays and then rolling into our support space after that, which will be our locker rooms and break room for our OR staff. That's coming along great. I don't see any schedule hiccups, knock on wood right now. The things are working really well and we're on schedule where we need to be. So the Hayner Hoyt team driving all the subcontractors and making sure we're all getting to that schedule point has been a great opportunity to work with them. And we're excited for phase 3 to kick off, and who knows, maybe phase 4 and a couple other things coming up.
Yeah. Oh, Alan's giving us some teasers. Teasers,
man.
everyone. Teasers coming. Love Rome Health. I got a tough, the other side of it, right? I got to ask the tough question. What do you carry in every day? You're like, that was like the worst project, or I don't want to carry that workload in. I think a lot of us have it, even though I would say Rome Health is the greatest place to work in the whole world, right, Alan? I mean, I think that.
It's absolutely a great place to be.
Thank you.
Yeah.
Thanks, Alan. But what's the toughest? What's either been the toughest or that you're carrying in to the organization of just like, this is a tough part of the role or the timeline?
A lot of ours is some of the aging infrastructure that we're dealing with. I mean, when we look at our building stems from 39 to present day construction. Wow. So when we're dealing with the 1939 sections, it's been redone over the years, but there's pieces and parts that definitely are starting to show their age. The roof is always everywhere you go, a roof is an issue to deal with because it's a piece of equipment that you don't really look at until it's leaking and there's a problem. So dealing with some of our aging infrastructure is definitely becoming a little bit more of a challenge, but I think we're doing a great job of it, prioritizing what we need to go after every year and working with Ryan Thompson, be able to figure out what our next steps and our next thoughts have to be, and then make sure we get them in the pipeline for projects and maybe add on other projects that we're doing at the same time, like we just did with the virtual nursing. Yeah. We were able to capture the room, give it a facelift for the patients, so that when we do open virtual nursing, it's got a fresh wax floor, fresh painted walls. The virtual nursing stood up. So we really just kind of, anything we can couple on other little projects to help is going to help with that infrastructure changes.
Yeah. Thank you, Alan. I'm glad you pointed that out. 1939, friends. 1939 till present day. I mean, that is a wide range to try to maintain. And there's regs and there's all that you have to keep track of. Thank you for that reminder, Alan. I mean, you had a big lift on your hand with the team. You mentioned this a little bit about parking, but on behalf of myself and the rest of the workforce, what can we do for you and the teams that you serve to help and be even better, like collaborators with all that you guys have going on?
Just be patient. I think when sometimes we get the calls, things get a little heightened, and the team tries to do everything they can and be everywhere they can be for everybody. We've had a great, I want to say, busy with the census lately, and environmental services can be kind of strained when they're trying to turn them rooms over fast for the nursing staff to get patients in. Same thing with plan ops. We had 4 guys out salting and plowing the other day when it was black ice out that we really didn't think we had to deal with, and it put things in a delay in the house, definitely for sure. So I just ask that, everybody be patient with the teams. We'll definitely get to your request as fast as we can.
Nice.
That's what we're here for. Again, I preach to all my teams that we're here for service.
Yeah.
We're a service to the organization. We'll do everything we can to make sure we get that service, but a little patience here and there goes a long way with the staff.
Nice. We can do that. We can do that, everybody,
Absolutely.
right? Yeah, we got that, Chuck. We can be patient. And if you haven't high-fived Alan or a member of the departments that serve us so well, please do so. We're learning a little bit more. And Brightly is still a really important method to communicate needs, right?
Absolutely, it is. Any kind of work request that you guys have, please don't hesitate. Put it in Brightly. If you're unsure, we'll sort it out when we get it downstairs and we queue it up. But that is the number one communication to us. We're working with the nursing staff and the nursing supervisors to help them, give them some more tools out of Brightly to use.
Nice.
So they can see like room turnovers and room cleanings better and have a better focus on where our staff is when they need them for things. So yeah, absolutely. Put the Brightly work orders in, help us out. We'll sort them out and help you out as fast as we can.
Excellent. Gosh, thanks, Alan. It's that time in the episode where we get to learn a little bit more about Alan on a deeper level.
Oh, boy.
Yeah. I love the whole boy. Like, people are like,
Now I cued the music.
yeah. Oh, nice. So we have our rapid fire. Alan, I know that you've been probably, because this is your favorite podcast, I'm sure, that you ever listen to, that you have maybe have an idea of what the rapid fire is. But we're always curious, aren't we, everyone, to hear what it is our guest is going to say.
I'm excited for this one.
Yeah, we get to, I know. I'm excited about Alan, too. What is your favorite go-to gas station snack?
Beef jerky.
Beef jerky, that's the
That's
second.
two. Yeah, that's two.
Yes,
Yep.
what was it? Tabby and the beef jerky. Okay, protein.
Yep.
Protein, yeah. And you just probably like it. Have you
Well,
always liked beef jerky? I'm not a beef
yeah.
jerky gal. I got to say that.
Yeah, absolutely. I'm on the road a lot with my daughter for travel hockey, so it's it's almost a meal some days when you're driving 8-9 hours for a hockey game somewhere, ridiculous amount of time. So,
Sure.
Yeah.
Oh, so you're not just a great director, you're a great dad, too.
No, I try.
Yeah. So, okay. Have you ever won a contest?
Yes, I won a contest here actually when the IAHF was playing in Utica, and all the World Female Championships were here in Utica with the hockey team.
That was very exciting.
I won tickets to the gold medal round game.
Alan, and you went?
I did. I took my daughter, and yes, I took my daughter, and she absolutely loved it. I had to think it was for my daughter or my wife. My daughter was working a lot of games that weekend, so it was kind
Sure.
of busy. But yeah, it was a great time.
Oh, it was worth it.
Oh yeah, absolutely.
Oh, congratulations. That's a good one. I think that's one of the best ones we've
Yeah,
had.
yeah.
This one people get stuck on. They really do. Now, favorite toy as an adult that we can talk about on AMC Connects.
I have two of them actually. In the spring, summer, and fall, you'll see me with my golf clubs.
Nice.
Any chance I absolutely can.
Alan.
And then I just took up snowmobiling with my son this winter, so
Wow.
it's a whole new breath of fresh air out there, literally, to be on the trails.
Yeah, it's been crisp though.
It's been real crisp, yes.
Yeah.
What a way to
Chilly.
start.
It's been a great
start.
time to hang out with him and go out and do something that he loves too. So
Oh, that's great, Dad. Wow. Good for you, Alan. I snowmobiled when I was in high school with a close friend, and I have to say it's very energizing. But I was cold. I'll be honest, it was cold. I never quite figured out the gloves to get. I think it's better now. I'm old now, so
yeah, it's
they've
definitely
got better-
refreshing.
Yeah, refreshing. That's the right word. Okay, hidden talent. What is your hidden? What do we not know about you, Alan?
some people do, but some people don't. I love working with wood. I've taken up a wood hobby. I've always dabbled in it a little bit here and there, but recently, last few years, I've kind of buckled down and I started making some furniture, just tinkering around the garage, a little stress relief here and there, and kind of take my mind off everything and just go out and work on whatever project I'm working on. I just made a couple of tables actually this past year.
I
Nice.
need a new end table, like right by my bed. I need one of those narrow. Alan, I'm going to be waiting for it. That's great. Oh, Alan, you're a great sport. We have an AMC Connects just for you, because certainly being on the episode means a lot, and being able to have you pass the word. And, I think people do really appreciate how much we've done in such a short period of time. And you being the person that has had one of the largest technical lifts to be able to make our dreams come true. Right? I mean, our dreams.
Absolutely.
Yeah. Thank you, Alan. Thanks for being on the episode and talking more. We're going to have you back because there's a lot going on. Oh, before I let you go, you had some teasers out there. Is there any teaser that you can share with us that might be happening in the future that we don't know about?
We are currently looking at when we're going to kick off our MRI project.
Oh,
We
boy.
have not talked about that. Go,
Yeah.
Alan.
Big remodel project coming up for our MRI team. Ryan and I have engaged with our contractors on getting that started. So probably around mid-spring, you'll start seeing some movement with getting our temporary trailer set up and get that off and running. Hopefully have that buttoned up by fall and into our next project.
Nice.
Whatever it may be for the day.
Thank you, Alan. That's a great one.
Yeah.
More to come, everybody. Alan has the secrets, I guess. So we'll have to have him on more often or be able to tap him a little bit. That's going to be a very exciting project, making sure that we have medical imaging access. We are seeing patients from across the region because there is limited access in radiology services. So it's wonderful to be able to embark upon this project. And we have a phenomenal medical imaging department here. I've received my services here. It's just really tremendous. So we're excited for that project. Well, we're going to take a break before we summarize and close off the episode. We've got a great medical minute for you.
Rum Health became a primary stroke center back in 2023. What that means for our community is we can take care of stroke patients here in our facility. We're able to give clot-busting medications and facilitate transfers to higher levels of care if needed. If not, our patients can stay here in our hospital and get care and be discharged right from Rum. Prevention is worth so much. So follow up with your primary care physician. Maintain your blood pressure. Check your blood pressure. Decrease salt, increase exercise. If you smoke, stop. If you use drugs, don't do that. There's a bunch of different things we can do. If you have questions, you can always reach out to us here. If you feel you're having a stroke, call 911 and get yourself to the closest hospital. It may not be us, it may be another facility, but regardless, time is brain. Every minute you waste, brain cells die and we can't recover that.
Wow, thank you. Heather Perry, she has just done an amazing job coordinating our stroke program. We have grown by leaps and bounds, not only with volumes of patients we've been able to see, but certainly the quality of care that we're delivering. Very proud of all of our clinicians, her in particular, for coordinating such amazing care. I did also want to close with a fine point. Alan had said it a few times, so proud of nursing and support services coming together, a couple different support services, IT, building services, just amazing work around our virtual nursing program, which we've talked a little bit about on one of the pilot podcasts, one of the earliest episodes we've had here. We did have Sarah Dutch, our nurse leader, overseeing our virtual nursing program. And if you haven't heard about virtual nursing, our virtual nurses are an integral part of the care team while a patient is in the hospital. They work alongside the bedside nurses to provide the best care possible. Our virtual nurses are hospital employees with years of clinical experience. What is a virtual nurse? A virtual nurse is a licensed nurse who provides patient care remotely using the TV cameras and speakers in your room. What does the virtual nurse do? The virtual nurse right now is assisting in the discharge process and transitioning patients into the community, but they will be assisting with admissions, provide patient and family education, and monitor conditions of patients. How is privacy handled? This is a good question. The system is designed to keep your safety and privacy a top priority. When the camera is not in use, it faces away from you. You will hear a door chime when the virtual is requesting permission to enter your room in the virtual session. Where are our virtual nurses located? This is a question I've had a lot of. The virtual nurses work actually in a hospital space that maintains patient privacy to keep your your information secure. That's what Allen was talking about. Our building services team has just done a great job making sure that we launch a site for this very technologically state-of-the-art intervention that we're doing. What if I have additional questions about the virtual nurse? Please contact your care team if you have any questions about the program. You can always talk to Ashley Edwards or email Sarah Dutch and connect with her if you have additional questions. Very proud of all the work that we're doing here in 2026. And what I'm the most excited about is the interdisciplinary work. Everything we're doing together these days has to be done with all of our different specialties in mind. So thank you everyone for creating the best care out there here.